Hello, everyone. Today I'm going to talk to you about simulations, which I feel are a needed alternative in learning. Hello, everyone. My name is Carrie Bonner. I am an RN and I currently teach LPN students. One of the challenges I have noticed as a nursing instructor is the traditional clinical rotation model. Are there more effective ways to ensure students get hands on experience? When you are at a rural hospital, there aren't many patients. Students sometimes have to share a patient. When this happens, I try to maximize the time spent since they both have to do the head to toe assessment, which can be broken down. One could do the pulse while the other does respirations. One listens to the heart, the other to the lungs. You can listen to the bowel sounds, check the right side while the other one checks the left side, and they take turns asking questions. Since they are together, giving them time to write down their answers and not drag out the assessment. This also gives them a chance to practice teamwork and time management. Clinical site saturation. Part of the problem is rural hospitals with clinical site saturation. Multiple schools competing for the same specialties, such as pediatrics, OB, mental health. Students shadow more than actively doing anything. Furthermore, some of these specialties only allow 4 to 5 students at a time, further putting stress on getting hours in at those sites. Adding an OB simulation can give some of the hands on training that would be needed. Large clinical groups. The lack of patients and low census levels creates significant stress for instructors and hospital staff. I have what is considered large clinical groups with 9 students in one group and 10 in another. I am constantly looking for hands on experiences like injections, blood draws, IV starts, IV discontinuation, um, hanging IVs, and even medication passes for all of my students. The nursing community in general recognizes this issue, which is why simulation has become important. Students often complain because they feel that the mannequin isn't real nursing. I like to remind them that they can't kill the mannequin, but they could kill a real person. In teaching and learning in nursing, virtual and blended models, not just mannequins, the virtual reality, an extensive hybrid model combining in person and extensive virtual simulations, resulted in students reporting higher clinical confidence despite having fewer traditional bedside hours. And some of those simulations can get pretty extensive depending on what is set up for them to do. So, listening to the lung sounds, you can listen to all the different lung sounds, and it can tell you when you're listening to in a certain quadrant. So it makes it interesting. And then they can hear abnormal sounds, not just normal sounds, and get used to what those sounds sound like. Blended simulation. Blended simulation studies demonstrate significant improvements in nursing students' clinical judgment, fostering clinical thinking, promoting confidence, and addressing clinical site saturation by bridging the theory practice gap. Students can demonstrate applied knowledge and individuality all within a lifelike context. The best participants will be nursing students at rural hospitals with low census. Being a nursing instructor, I have access to the nursing students. They will be familiar with the clinical site saturation and passive learning scenarios. They will participate in interviews and help with a team based approach to improving learning outcomes and addressing underutilized clinical settings. Participants would work in pairs, doing head to toe assessments together. They would divide the work. They're expected to adapt to the clinical site saturation by sharing the limited number of patients, but maximizing time spent with the patient, giving them the chance to practice teamwork and time management. Quantitative. The basic elements of a quantitative study include collecting data using numerical values, conducting statistical analysis to address research questions, and testing hypotheses. Also, the key components include reliable data collection methods and thorough statistical analysis to support the conclusions, such as closed-ended surveys, physiological measurements, and computerized tracking. Therefore, researchers can collect data and, by involving students, patients, and even the public, demonstrate real-world outcomes as noted by Oliver. When properly balanced, this input enhances the study's relevance and can be reflected in the community served. Qualitative. The basic elements in a qualitative study focuses on exploring the how and why of data by analyzing non-numerical data using interviews, open-ended questions, how and why surveys, and observations. The key elements include defining the question, choosing appropriate methods, gathering the data, and analyzing all of it to find patterns. CUSIN. The six CUSIN guidelines. Number one, patient-centered care. In a simulated-based learning, mannequins can be programmed to include the specific background, health history, and clinical condition needed. This would allow nursing students to engage in therapeutic communication, show empathy, and provide individualized care in a controlled environment. The second one, teamwork and collaboration, can focus on an effective communication, such as utilizing the S-bar communication with the healthcare team. By using simulations, students can work together, delegate, and even communicate with providers. The third one, evidence-based practice during simulation, students follow current care and clinical guidelines while managing patient conditions. This helps students navigate the scenario while enforcing the importance of using evidence to support their clinical decisions. The fourth one, quality improvement. After the simulation scenario is completed, taking the time to reflect on decisions made and outcomes allows time for the students to think about errors or potential alternatives to the care provided. The fifth one, safety. Simulation labs provide a safe, controlled environment where students can learn from their mistakes without harming a real person. And the last one, informatics. The simulation environment often uses electronic health records for training and practice equipment. This helps students gain knowledge in the use of digital systems, supporting safe care. In conclusion, the simulations and varied clinical models are becoming increasingly necessary, even though they are met with student complaints. Being reminded that it is a safe environment that promotes clinical thinking ensures our rural students become confident. Simulation labs provide real life scenarios that carry over into real life savings. Thank you for listening to me today.